which is part of why we actually put one of our IL coordinators over at the hospital to act as an information referral specialist and help people coordinate with getting their discharge plans from the time that they enter the hospital, help them start thinking about what equipment they're going to need and what they're going to need access to, where they're going to need a ramp to go home, because lots of times the discharge planners are not thinking about that when they first come to the door. They're thinking about it, 3 days before the person's going home, and then we're getting the phone call saying this person needs a ramp. And so, it is one small effort that we've tried to get that person in the door first, talking with people as they enter the rehab center, as opposed to right before they're going home. And then they can already make the request and have communication with the staff over here, and we can be looking for the equipment that they might need if we don't already have it available. The hospital hospital absolutely loves it. First of all, it's a person with a disability, who's utilizing a chair. So it's a very visual opportunity for communication, to see somebody who's working and return to do a lot of things prior to injury. And the fact that that person can communicate with the patients. Now, I'll tell you who doesn't tend to like it has been the social workers and the PTs and the OTs, because sometimes they feel like when that person's making recommendations that it's kind of stepping on their toes or their professionalism if it's not been something that they've recommended. Or if that person is acting as an advocate saying, have you tried this, or had you thought about this? If it hasn't come from the professional, then there's a little bit of struggle. The hospital actually set up a room, information referral resource room with varying information from not just us, but community resources, so that patients and their family members can talk with them. And then the recent stride that we had achieved was actually getting him involved as part of the discharge plan on the team that has the conversation. The hospital provides a space, and we had hoped that the hospital would assume the salary eventually, and that's still been in discussion. It hasn't occurred yet. So the Walton Rehab has Walton Foundation, which is separate but does fund. And then we do receive, for example, this year they agreed to contribute up to $5,000 towards materials for volunteer projects. So we had people like the Rotary Club, the AARP, a few of the churches that were willing to do the labor, but they didn't have the money to purchase material. So we got Walton to set aside $5,000 towards the material costs so that we could, get more bang for the buck through that. So, yeah, they're not paying for his salary, but there's other ways that the relationship, builds the continuum. Yeah, and they're willing. It's just the hospital. So many of them are going through financial transitions themselves. Now, where I'd like to see it is also in more of the other hospitals, and we've looked at some grants and some discussions with AAA because of this now. This issue with reentry. The penalties for people reentering. If they would have these conversations beforehand and have us involved, then we can help with some of that planning. And I think it would be affordable if they funded positions. Social workers, they're trained towards a certain direction. And I think without personal experience, sometimes they miss that part of it. So if it's an advocate or a coordinator who actually is coming from consumer-driven philosophy, then I think they could see more benefit to some of the definitions and objectives in the discharge plan. We get donations on behalf at times, but the other part is lots of times those patients, obviously, if they're in the hospital, many of them have insurance. So acquisition of technology or durable medical equipment doesn't necessarily have to come this program. This program should be, kind of a last resort for people who don't have access. There's no reason why that person isn't also helping them make decisions on the proper equipment that the insurance would in fact pay for. So it's still provision of assistive technology, but then it's that referral technical assistance piece as opposed to actually providing the device. It even goes as far as, people needing van modifications, because David, who's over there, drives a van, and recently he had made a referral by showing his own van to a few companies that would provide modular vans, and the person ended up making a purchase. And so that company came back and, thanked us for the referral. So